Greetings, everybody, and welcome to New York State. This presentation will talk about the laws referring to IDEA for students with disabilities. Just to give you a little backup about New York State, there currently are about 3 million students in New York State, and in 2018, there was a high demand of parents and educational professionals talking about testing times, so they reduced it from 3 days to 2 days for math and science, and they also are working on translating all the information into several different languages and not just English. We are looking to have our teachers well trained. We are looking to use the best teaching methods, and if there's any social or emotional needs, the state is willing to work with the schools, ask for advice. We will even visit you if you need to. Also, the state is keeping parents and guardians informed with reports and how districts are doing. Moving on, what is IDEA? IDEA is the Individuals with Disabilities Act, was reauthorized by Congress in 2004. It's a law that makes available free and appropriate public education to eligible children with disabilities throughout the nation and ensures special education and related services to those children. In 2015, ESSA, or Every Student Succeeds Act, was passed, and those changes were made to IDEA. What is Section 504? Section 504 of the Rehabilitation Act of 1975 is a federal civil rights law that prohibits discrimination based on disability in any program or activity operated by recipients of federal funds. So in a nutshell, schools basically develop formal plans to give students with disabilities the support that they need to succeed in life. What are the classifications of disability? They are autism, deafness, deafblindness, emotional disability, hearing impairment, learning disability, intellectual disability, multiple disabilities, orthopedic impairment, other health, speech or language, traumatic brain injury, visual impairment, which includes blindness. Emotional disability is highlighted in orange because last year New York State changed the words from emotional disturbed to emotional disability. What are the 6 principles of IDEA? They are FAPE, or free and appropriate public education, appropriate evaluation, IEP, individualized education program, LRE, least restrictive environment, parent and student participation in decision making, and procedural safeguards. Let's move on to the new laws that New York State has initiated. Last year, on January 14th of 2022, Governor Kathy Hochul wrote a one-page document, and the resources at the bottom of the page, the link, that states a school district may provide educational services in the 2022 to 2023 school year to a student who turned 21 years old during the 2021 to 2022 school year and was enrolled in the school district and receiving special education services pursuant to the Individualized Education Program. Such student may continue to receive such educational services until the student completes the services pursuant to the Individualized Education Program or turns 23 years old, whichever is sooner. This act was taken into effect immediately, and will expire and be deemed for repeal next June of 2024. Let's talk about the new guidelines with student discipline that was initiated in 2022. This is a 57-page document. They will evaluate students and identify problems. It talks about illegal drug and substance abuse and change placement. So out of this, we want to make sure under evaluate student and identify problems that we want to make sure that if there is a discipline problem, are those needs being met with that student? Is it reflected in the IEP? Is the problem going to happen again? What can we do to rectify the problem so it doesn't happen again? We want to make sure that the student is protected under this program, and if they're not, we want to make sure that they are. The illegal drug and substance abuse refers to students if they are in a treatment program and there are disciplinary actions that need to be taken, they will have the same rights as a student in a non-specialized program. If, however, they are using illegal drugs or substance abuse and are not in a treatment program, they will not have those rights. And then for change placement, if there is an extreme situation where a student needs disciplining and we need to either change the placement, the school, the location for that student, it can be done, but there needs to be, after 10 days, a manifestation determination, not only by the parents, but the school and the IEP team. We want to make sure that these students are not lacking any skills moving forward. Moving on to restraint and seclusion laws, we talk about the limited physical force, no physical restraint, the prohibition of corporate punishment, and a timeout room. For limited physical force, we want to make sure if a student has used arms or legs to injure or to have a bad situation, we want to make sure that we limit the movement of the limb and what the student is doing. We don't limit the use of the leg or the hand or whatever limb the person is using, the student is using. We want to make sure that we just restrain them, but not in a physical harmful way. We just want to make sure the student does not cause harm to him or herself or to other students. Also, there is totally a prohibition of corporal punishment. New York State does not look at this in any way. They don't even like using these words, but it is written in their laws. The timeout room is really specific to if a student is in danger of themselves or hurting others. Each district should have some sort of timeout room. It needs to be well lit. It cannot be locked. And we have to make sure that there are policies in place to use this timeout room, and the new law is to make sure that the parents are notified. Then we have to go back and say, hey, is this timeout room really working? Do we need to specify it in the IEP? These are just really for extreme cases. We want to make sure, again, procedures are in place and parents are notified either by email, phone, or documentation. Next on the list is updating the guidelines for medication. We talk about confidentiality, children that can self-medicate, a medicated staff professional, and opioid guidelines. Under the confidentiality and FERPA guidelines, which stands for Family Educational Rights and Privacy Act, we want to make sure that if there is an issue with medication, it's handled delicately. We don't want to tell everybody what the student is on or what it's for. We have to make sure that we're very careful with our guidelines. We don't have to follow HIPAA guidelines, but we have to make sure that we're being respectful to the patient, the parent, and the student, and it's documented. There are some instances where students can self-medicate. They know when to take it, when it's written down. And if they can't, then that's when we have a qualified nurse or medical staff on duty that can assist with submitting these medications when required. Some schools, not all, have an updated opioid guidelines where they have either a kit there or a person that's able to distribute it, but these have also been updated. And last, in 2022, the homebound instructions, which is a new regulation 100.22, was instituted. And it's actually still in the process. So I'll just go over briefly what it entails. So due to COVID, there has been a lot of concerns about children being re-emerged with other students, or anxiety problems or medical problems. And a lot of home people are asking for their children to be educated at home. And if this is a child who is at home greater than 10 days out of a 3-month period, you can't just say my child has emotional disability or an anxiety. You have to really pull in the healthcare provider and say, what's going on here? Why do you feel the child needs to be educated at home or benefits the child to be educated at home? So we need to have documentation. We need to have input from a primary care. We also want to know what current district you're living in, because there are some instances where you may be living in one district and your child goes to school in another district. Whether it's a specialized school, a charter school, a public or private school, things of that nature. We want to make sure that all necessary services are being eligible for that student. We also want to make sure that we develop a specific instructional plan so that student is getting all the necessary special needs that he or she is entitled to. And then we're finding out about certain hours and what people are doing and teaching their children. So this year, in July of 2023, New York State will implement at least 10 hours a week of learning for elementary children and at least 15 hours a week for secondary schools. It can be more, but it definitely can't be less. Again, the resources are at the link below the page. This is just a follow-up to what I mentioned earlier on the disabilities. The verbiage changed in New York State from emotional disturbed to emotionally disability. Hey, thanks for learning with me, and welcome to New York State.